From my personal experience, my son got very sick from RSV, and then ultimately it did take his life. So could you tell us a little bit about what RSV is?
So I always start by telling that RSV is a virus, and it's a virus that affects the airways, meaning your nose, your throat, and your lungs. And RSV will enter the airways through either the nose or the mouth or the eyes. The vaccine that we give to the newborns is different from the one that we give to the adults, right? Because the newborns, we give them the antibodies, so their immune system does not need to produce its own immune response. Whereas in the adults, we give them the protein vaccine so that their body can produce its own antibodies. So that is different.
So talking about vaccinating mums or mums-to-be to help protect their babies, that seems like quite a big ask to ask someone that's already, obviously protective of that unborn child to then have a new vaccination that we know nothing about, bearing in mind that not long ago we were asking people to do the same with COVID. Why do we need to have an RSV vaccine? Why is it important?
Yeah, it's a good question because it's yet another vaccine. The importance is because we want the newborn babies who are so vulnerable of becoming severely ill from an RSV infection to be protected as soon as possible. So you would want them to be protected from the moment they are born. And you can only achieve that if they get the antibodies from the mothers. And I always explain to patients or to parents that before these vaccines are approved, they go through very extensive trials, and when there's any doubts about that, they will not go through with admitting the vaccine. So I think it's safe to say that they've been extensively tested and it's safe to get the vaccine during pregnancy.
So the elderly population, is there a reason why they might be inclined to have the RSV? Is the infection more severe in RSV?
So a couple of years ago, I would have said, no, of course not. I think together with the data showing that the burden of disease is very high, a lot of hospital admissions occur in older adults because of RSV infections. It shows that RSV is a very serious virus for older adults as well. But I think that for vaccines, a lot of people have doubts or a lot of people have questions about them. For those, I think it's most important to talk to the patient as a doctor.